We're rapidly developing a vaccine, and they can speak to you. The professionals can speak to you about that. The vaccine is coming along well, and in speaking to the doctors, we think this is something that we can develop fairly rapidly, a vaccine.
Although this is the fastest we have ever gone from a sequence of a virus to a trial, it still will not be any applicable to the epidemic unless we really wait about a year to a year and a half.
So President Trump, they're contradicting one of the government's top experts on infectious diseases about the length of time it's going to take to develop a vaccine for the coronavirus, once again raising questions about the president's credibility as the nation is striving to deal with this potential public health crisis. Joining me now is Ben Rhodes, Deputy National Security Advisor to President Obama, and John Meacham, Pulitzer Prize-winning presidential historian and biographer. His new book is entitled The Hope of Glory: Reflections on the Last Words of Jesus from the Cross. Ben, I'm going to start with you on this one. The doctor that I actually just spoke to, she had published a piece in the Washington Post on governments need people's trust to stop an outbreak. Trust being the integral word there. This is an administration, as you well know, that has not handled crises well. During Hurricane Dorian, he showed a map which he had altered with a Sharpie showing an inaccurate forecast of where the storm was headed. And then you had Puerto Rico with him throwing the paper towels at the crowds. And then there was last night. Does this president and this administration have a credibility problem when it comes to crises like we're dealing with now?
Yes, they have a massive problem. And it's absolutely the case that trust matters. During the Ebola outbreak, we had daily briefings that were meant to give people the information that they needed to know what to be worried about, what not to be worried about, what precautions to take, what precautions not to take because they might be disruptive. And what we're seeing is essentially a perfect storm of the trap that the Trump administration has set for itself. They've lied repeatedly about really important matters, like what the basis was for killing an Iranian general, like the direction of a hurricane, like the crowd size at the inauguration on the very first day. And so the American people know that they can't trust the information that this president is giving them about this really critical issue that affects their daily lives. We also know that this administration has had a disdain for expertise in the government, which is reflected in the fact that they've cut CDC funding, tried to slash those budgets. And so really we're entering uncharted territory right now where the American people really, really need this information to know what to do and what not to do. And they can't trust the information they get.
I want you to put this in a little bit of a historical context for us, John Meacham, as you do so well. Talk to us about how other presidents have handled national emergencies, as Ben just spoke about with his former boss, President Obama, and others.
President Obama on Ebola is a great case study. George W. Bush and PEPFAR, the attack of the AIDS, HIV/AIDS in Africa, is one of the sterling elements of that president's legacy. Then you look back to the 1980s for a counterexample. And the government and President Reagan, the culture, political culture broadly put, was very slow to recognize what needed to be done, even that something needed to be done, and acknowledging that. And so it is, as ever, a mixed record. I think Ben's right about the essential role of fact here. And sometimes I think in this era, there's a bit of a paintball nature to fact. We sort of argue about things as if all this were a political game. Well, this is not a game. I always thought the first...
Stand by for a second, John, because Vice President Mike Pence is talking about the coronavirus right now at the CPAC. Let's take a listen.
All the patients have been treated and are doing well. And while the risk to the American public remains low, as the president said yesterday, we're ready. We're ready for anything. Yesterday, President Trump directed me to lead a whole-of-government approach to address the coronavirus in this country. And I promise you, we will continue to bring the full resources of the federal government to bear to protect the American people. And as the president also said, it's important to remember we're all in this together. This is not the time for partisanship.
So obviously hearing from the vice president there, John, basically saying all the patients that are being treated are actually doing quite well, that we are ready for everything, for anything and everything that happens, and that they have the full resources at their hands to deal with this crisis.
God willing, they're right. God help us if they're spinning this or overstating it, because it is a matter of life and death. This is as core an issue as you can get. I always thought a great crisis of trust would be over a foreign policy crisis, would be over the president saying something that he knew not to be true. This is even more elemental to some extent. And so we have to be willing to trust what we're being told. And one of the reasons Donald Trump is president is because in 1965, 77% of Americans trusted the federal government, and today it's less than 15%.
Unbelievable. Ben, do you think that this president is considering more the political loss amidst all of this versus the personal loss that could actually happen if this blows up into a full pandemic?
Yes, and what bothers me is you also have the administration taking away the tools that you usually use to communicate to the American people facts. There's no more a White House daily press briefing. During the Ebola pandemic, that is when we would lay out these facts. And you'd have the White House press secretary standing there with experts providing information. That podium is gone. That tool is no longer used to communicate to people. And if you look at President Trump, he uses Twitter. And the tweets that he's had about this virus have not borne out. He praised Xi Jinping for a strong response when, in fact, Xi Jinping's failure to be transparent about the coronavirus may have contributed to the way in which it spread. He seemed to want to calm financial markets to presumably help the economy and aid his reelection rather than provide facts. My hope is, as an American, that they get out of the way and, frankly, just let the experts give us these facts. Let CDC talk. The clip you showed at the beginning of Trump essentially spinning this about a vaccine and then the CDC and the professionals providing the facts. Let's hear from the professionals here, because I hate to say it, I wish it wasn't true, but the fact is there is a credibility gap, and that can be very dangerous in dealing with an epidemic like this.
Yeah, people are worried and they want the facts. They know what to do and what's real. Ben Rhodes, John Meacham, thank you both, and congratulations on the book, John.
Thank you.
#1 on Amazon, I hear.
Thank you. Jesus is alive and well.
There you go. Breaking news, everybody.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.